Hi, my name is Manoj, Krishna. I'm a spine surgeon. And today I want to tell you a story of a patient of mine who had a discectomy about 13 years ago and since then has had chronic back pain and right leg pain. On this MRI scan, looking at the spine from the side, one can see that the spinal canal is pinched at the L4-5 level, and this was causing her right leg pain. On the cross section, one can see um, the evidence of the previous laminectomy at the L4-5 level on the right side. And this is what was causing her chronic pain. After we tried a number of non-surgical options, we decided to proceed with surgery. We did a posterior lumbar interbody fusion at L4-5, where we replaced the disc with a cage packed with bone, and we restore the height of the disc to normal. And to protect the next level up from wear and tear, we put a dynamic stabilizer. One can see on the AP X-ray here what the dynamic stabilizer looks like. Here's Felicity in her own words. She's done really well from surgery. Good afternoon, Felicity.
Good afternoon.
So, how old are you, honey?
I am 68 years old.
68, okay. Tell me a story about your back problem and how it started, please.
My back problem started after an accident 13 and a half years ago,
Okay.
of which I had an operation, but I was still left in pain.
I think you had a decompression operation in 2010.
Yes, I did.
No,
2000.
2000, sorry, year 2000. Okay.
Year 2000, yeah.
Okay. And then after that, you will continue to have some pain?
Oh, yes, all the time. It was just at a slightly lower level.
Okay. And then about 2.5 years ago, the pain got worse. So tell me what happened then.
It got substantially worse. I was finding life extremely difficult. I was falling, I was unable to walk far, and my whole life evolved around how far, how near, where this is, where that is, will I make it? And it just disintegrated, and I couldn't put my sock or shoe on or things like that.
Okay. And then I saw you, and I think you tried all the non-surgical options by then. You had plenty of physio and all this stuff.
Yes. Failed.
Yes.
It all failed.
Okay. So about a year ago, we did a interbody fusion and a dynamic stabilization procedure. So please talk me through the surgery and then how you recovered.
Well, I went down to the theatre on the morning that we went up to Stockton, and the only thing I really remember about that is waking up in the recovery and them very kindly giving me a drink of tea.
Okay.
I don't really remember much after that until in the night time. You know, they do all these little things and seeing that you're okay, and everything went fine.
You were in hospital for what, 2 days?
That's all, yes. You took me for a walk around that very same morning after the operation.
That's right.
And I was perfectly straight.
Yeah.
I'd gone from having a permanent lean to being perfectly straight, which was a bit of a shock, really.
Yeah. And how did you recover? How long did it take you to get better after the surgery?
Well, I was better after the surgery, directly after that. I had the operation pain.
Mm-hmm.
But the strangest thing was that where my leg had been numb,
Mm-hmm.
I was starting to feel it. Feel my leg, and that was a strange thing to happen. You know, that was almost instantly, really.
And now you're a year from surgery.
Mm-hmm.
So tell me how you are doing at the moment, please.
Well, my life has completely changed. You know, it's better than it was 13 years ago. I mean, it's magnificent. I can walk, I can run upstairs even. That's a shock to the system.
How much pain do you have?
I don't really have any pain at all. Sometimes I take just a paracetamol at night because I think I haven't got used to not waking up when I want to turn over again.
Okay.
But it's because I get a little bit stiff, I think.
Okay.
But apart from that, nothing. Absolutely nothing.
And no more falls?
Absolutely. I haven't had one.
Okay.
Not one.
Okay. Felicity, thank you very much.